Welcome to the Evidence-Based Practice series at the Rite Aid Information Commons. This Evidence-Based Practice module is a training session for PICO. Formulating a focused question based on your clinical problem is the first step in the evidence-based practice process. A well-designed clinical question allows you to not only define the parameters of the clinical issue, but also allows you to target your search in the body of literature for the most appropriate research. The most common framework for creating a searchable clinical question is PICO. P stands for person, population, or patient. What is the problem you are looking at? Is there a specific population you need to focus on? This can include a patient's gender, age, race, or other attribute. I stands for intervention or indicator. What are the treatments or changes you are looking to explore? We consider drugs, diagnostic tests, or a certain type of procedure as interventions that we can examine. C stands for comparison. What alternatives are we comparing the intervention to? If we compare the intervention to nothing, this is known as a control. A placebo is a pill or treatment given to a patient that has no effect on the patient. O stands for outcome. What result or outcomes are we considering to see if the intervention is working? How do we accomplish, measure, and affect this outcome? Let's look at an example. Your hypothetical patient is a 72-year-old Caucasian woman recovering from a stroke 6 months ago. She's accompanied by her daughter. So far, the patient has met conversation coaching with some success, but the daughter remains frustrated that her mother freezes in family gatherings. She has heard of group therapy and wants to start. Her mother is concerned that the new treatment will mean more out-of-pocket costs. In this example, the patient is a 72-year-old woman of Caucasian descent with aphasia caused by stroke 6 months ago. The intervention is group therapy. The comparison is conversation therapy. And the outcome is better communication in group settings and higher confidence. If we were to write out our PICO question based on this information, we would write, in a 72-year-old woman with aphasia caused by stroke, can group therapy increase the amount of patients' speech confidence in groups compared with conversation therapy? Note that the PICO parameters are underlying and highlighting in black, blue, red, and green. This has been an introduction to PICO. If you have further questions on how to develop your PICO, please contact the Health Sciences Librarian at the Rite Aid Information Commons from the homepage of the library guide. Thank you for watching.